The CDC's disease detectives are on the front lines tracking the coronavirus. They work around the world to pinpoint the disease's moves and research outbreaks. Former disease detective Dr. Seema Yasmin spent 2 years as a member of the Epidemic Intelligence Service Squad of Contagion Hunters. She's now an assistant professor at Stanford and joins me this evening. Dr. Yasmin, good evening to you. Thanks so much for joining me. Very quickly, what exactly is a disease detective?
The disease detectives are part of this service called the Epidemic Intelligence Service, housed at the CDC, and they're a squad of doctors and scientists who are trained to be deployed at a moment's notice to anywhere in the world that an epidemic is spreading, really with the task to protect people and to stop the spread of contagion.
And Dr. Yasmin, we learned today of a case that's been identified here in New York of someone who had recently travelled back from Iran. What measures will disease detectives be taking tonight to try and track anybody that patient may have infected?
So I think what's really interesting about this, Wilfred, is how low-tech some of the public health defences are. And actually, they work really well. So yes, we have genome sequencing and we have lots of assays and tests. But what it comes down to with a case like this one in New York is face-to-face interviews, building trust with people who are sick and frightened and anxious in the middle of an epidemic, trying to really find out, where were you when you first became sick? Who did you come into contact with? Where did you go? And not just your contacts, but your contacts' contacts and their contacts too. You're really trying to get a handle on who's been exposed and trying to isolate them as early as possible to stop the further spread of disease.
And Dr. Yasmin, I presume time is absolutely of the essence in this type of process. What's the key cutoff if you feel like you haven't found everyone within that time where the spread becomes impossible to contain?
So with this epidemic, I really think that we are past the point of containment and we really are pivoting towards trying to slow the spread of disease as much as possible. But in terms of doing those interviews face-to-face and boots on the ground, trying to find cases and trying to isolate people, there's no time limit to that. You are doing that day in, day out. It's extremely grueling, as I said, low-tech work. And one of the interesting things we've learned looking back almost 20 years to the SARS epidemic was the World Health Organization reports now say that what helped us get a handle on that crisis wasn't 21st century technology, it was 19th century boots on the ground epidemiology, the kind of contact tracing that I'm describing.
To what do you mean when you say, Dr. Yasmin, that we're past the point of no return? I mean, how many cases do you expect to arise in the US?
So hard to tell exactly in terms of numbers. And one of the issues in the US, of course, has been the blunders and the delays with testing. We probably already have hundreds, if not thousands of people exposed and infected within the US and just aren't able to categorize them because we haven't had a test. But what I mean about being beyond the point of containment is we saw China especially really implement these massive quarantines. Those are the kinds of things that countries can try and do to contain a virus, although probably nowhere else in the world can do it to the extent that China did and do it in that particular way. But I think we're past that point of just trying to limit it to certain countries. We're seeing it in more than 60 countries already. That's why I say it's past that point of containment. We have to appreciate that this virus is spreading and really think about protecting vulnerable populations, including healthcare workers.
And that said, Dr. Yasmin, are you encouraged by the quality and availability of care in the US?
I am not. I am quite disturbed by what's happening here in terms of people going to get tests and then being given a bill for more than $3,000. Compare that happening in the US to what we're seeing in South Korea, where they're doing testing for free and people are doing drive-through testing. They sit in their car, they get given a test, they're given results in a few moments. That's really the kind of testing, really the kind of universal access to healthcare that you need all the time, but especially during a public health crisis like this one. And for anyone thinking, well, I have insurance, I live in a place where everyone has insurance and I'll be okay, you're not safe, because the weakest link will always be those vulnerable people who don't have money, don't have access to healthcare. They are vulnerable, but that also jeopardizes public health in general.